I am Brian Edwards. I am the consultant for Atlanta, and along with Neil Mehta, we'll be presenting the care tracker information. Next slide, please. So hopefully everybody is aware that by this Thursday, December 3rd at 7 p.m., you're eligible to earn $500 if you complete 100% of your Care Tracker Q2 panel. So that's all the information that's in Care Tracker. If you have no open items, you're at 100%. And then your practice will earn $500. That's a really easy way to do the things that you've already been doing and to earn some extra money. There are some new and exciting things that are coming to Care Tracker on December 7th, ER frequent flyers, and high-cost, high-risk patients. I emailed everybody, and your consultants will start training everybody on how to work these new things. Also, as of February 2021, you will have another opportunity to earn another $500 reward if you complete the new panel, so Q3 panel, by the end of February 2021. So December 3rd, you have to get all your stuff done to earn your 100%. And then in February, you have another opportunity to earn $500. Neil is going to be presenting these next few slides. Next slide, please.
So, Brian, before I let you go, tell me how many practices will make $500 this week?
Right now, we have 19 practices who have already completed 100% of their panel.
Awesome.
Yeah, that is an awesome thing. Very much.
Let's catch up. All right, Neil, come on, tell us about it.
Hey, good evening, everyone. My name is Neil Mehta. I'm from the Dayton and Indiana region. So like Dr. Agarwal and Brian said, we have just a couple days until we can reach that $500 mark, and 19 practices have reached the 100% goal. Now, 6 practices are within the 90% and 99%, 5 practices between the 70 and 89%, 7 are between 40 and 69, and there are 2 practices that round out at 1% through 39%. So getting to that 100% could just mean a couple extra actions here or there. So let's work really hard over the next couple days to get as many actions in as possible to reach that 100% goal. Next slide. So to see where you are right now, these are a list of the practices that have completed the 100% goal. Now, this doesn't mean that you're done using Care Tracker. You want to continuously use it on a daily basis, but you have reached the goal to receive the $500 payment. So congratulations. Next slide. The practices on the left are at the 90% through 99%. Again, this could just mean that you have a couple extra actions that you need to take in order to reach that 100% mark. So we still have a couple days to do so. On the right, the practices between 70 and 89%, those you may need to work a little bit more diligently over the next few days. But again, it's not impossible to get those actions completed up to 100% by the end of the day on Thursday. Next slide. Here are the practices that are on the lower tier of the threshold. This will be a little bit tougher to get to that 100%, but if you work pretty diligently the next couple of days with your office staff to try to schedule the wellness visits, try to get those call to actions completed, then you could at least get close enough to the 100% that, who knows, you could reach 100% by 7 p.m. on Thursday. Now, the practices on the right are on the bottom tier. This is a little bit tougher because we only have a couple days, but I think it's safe to say that a lot of the practices on these last few lists are using Care Tracker and getting used to it and understanding its benefit a lot more daily. So it's going to be really important that this was our practice period essentially, and we have new tranches of data coming out that now, since you have some practice on your belt, this next group of data that we provide you with drop patient lists, et cetera, you'll be able to jump on it immediately and get to that 100% a lot quicker than this first go around. Next slide. And
So there
yeah.
are some very important changes coming to Care Tracker. These are for the same patients that are currently in there. So categories that we'll have the next actions on will be as call that are in open and pending will move to open if the same category for the same patient is uploaded, but only one category tab will be displayed. This is a missed opportunity. So say you had a patient who had an annual wellness visit that was done in July, it got missed, that this patient will come back up as a missed opportunity and you'll be able to capture him now. Patients that are enclosed will move to open when they're applicable, depending on the timing. It's okay to have one patient in verified visit and another patient in call. New categories or new reports that will be available is your high cost, high risk patients and your emergency room frequent flyers, the patients who misuse the emergency room. Next slide, please. This is the Care Tracker Missed Opportunity Calculation Tool. As you can see in the upper left-hand corner, it says the Medicare panel. If you plug in what your panel is, it could be 134, it could be 410, 237, it will give you what the revenue is for that panel based upon the average number of visits. It provides an example of how the current Medicare and annual wellness performance can be improved by using Care Tracker. Current Medicare performance with a Medicare panel of 134 in 4 visits, it will show you what the revenue will be and what your future revenue will be for future Medicare performance. It also will, in the bottom left-hand corner, annual wellness current performance. So if your Medicare panel is 134, you have a revenue of that $16,080. If you saw those patients a little bit more, that shows you the missed opportunity for annual wellness visits. Because as we know, patients fall through the cracks, and that's what Care Tracker is trying to help with. Annual wellness future performance using Care Tracker, you can expect an increase of 10% of patient volume. So Care Tracker is a wonderful tool to use. Kudos to those practices who have already reached 100% of their panel. Those who are still working, you still have time to get that $500. Myself, Rochelle, and Neil look forward to hand delivering those checks to you and sharing in that great reward